As a healthcare provider, you're faced with two major challenges. Number one, rising costs for providing your services, and number two, reimbursement cuts for those services. This also makes it difficult for you to control cost while also ensuring the best patient outcome and care. My name is John Bentley. I'm president of Power2Transform, and we provide two major services to help you overcome these challenges. First, it's developing vital leaders who know how to collaborate and build trust across departments to accomplish your major goals. And secondly, those vital leaders understand the importance of developing a healthy work environment where employees come to work every day and give their best and understand their role in helping cut costs and provide better patient outcomes. Over the past 4 years, we've been privileged to serve Coleman Regional Medical Center, and they're going to share with you how our solutions have helped them achieve better outcomes in both patient care and cutting costs.
Our organization really faced challenges that are similar probably to all organizations across the country, and that is we're challenged to do more with less. And yet we wanted to make sure that we were on top of our patient satisfaction. We wanted those scores to be high. We wanted to provide that quality care.
We recognized that in order to do that, we had to have the best leadership and a sense of direction that we could have for the 1,000 employees that we have at the hospital.
We were very disjointed as a group of leaders. We were very competitive with each other, and instead of working as a team, we tended to work against each other to try to fulfill goals for just our departments instead of the organization as a whole.
About 4 years ago, we decided to create a leadership institute, and we had no idea how to do it.
What is the best education that our staff and our facility needs to help us improve and to provide better patient care, and then identifying how to roll that out in an atmosphere that works well for our team.
And that's difficult to find.
So we look to Power2Transform to really help take our organization where we were to that next level.
One of the things that has impressed me the most with Power2Transform is that they took the time to get to know our organization.
We've used other vendors in the past, consultants, and many times they seem to have canned type programs.
John and his group have been very easy to work with to tailor what we need with what they can bring to us.
And that enabled each of us to identify where our strengths were and then how we can take it back to our everyday work environment and make improvements to help us and our team.
We identified that we had a lot of communication waste. We were calling back and forth, asking about arrival times for patients, preparedness of the patients, and different states of readiness for those patients.
And so we felt using visual cues that we would set up an electronic tracking whereby the patient was tracked at every juncture throughout the process so that there was a significant elimination of waste.
The time saved not only resulted in shorter work days, but more importantly allowed us to give more direct patient care time to our patients.
One example was with our nursing home discharges. We were struggling some with how to improve that discharge process. So when we implemented and we worked with the company to identify where were we falling out, we identified around $250,000 in waste with that process. So then by working with the Lean and the Six Sigma, we were able to eliminate that, and then in the end it was around a $90,000 savings.
It's been an exciting transformation within our organization. We've improved in efficiency, maybe increased our patient satisfaction.
We have been much more effective in getting the three leadership groups of any hospital, the management team, the board of directors, and the medical staff, has been much more effective communication because we have a common language.
One of our departments recently was having some trouble within the department, some interaction, some interpersonal skills, and it was not a good work environment. So John was able to come in with Power2Transform and meet with the staff. And then they were able to come up with a plan to help that department to grow and improve and to have a better working relationship. And based on that, when they were able to do that and grow and improve and feel good about coming into work and the people they were working with, that in turn spilled over to other departments.
And that pride takes over and transfers over to the patients that they touch. Because if you're a satisfied employee, I guarantee you're going to give better patient care.
I think other facilities it would be very beneficial for them to partner with John and Power2Transform, because I've seen the results of what they've done.
John and his team with Power2Transform was really the catalyst that set us on a journey of excellence, not only in quality but in patient satisfaction. As evidence of that, in the last 4 years, our hospital has been rated 11th best in the country out of 5,000 hospitals.
If you have an organization that's not willing to challenge itself and that's not willing to really want to find ways to improve, they're going to be left behind. By using Power2Transform, they've been able to help keep us really on the cutting edge of a lot of things as far as it relates to patient satisfaction, equipping frontline staff to be the very best that they can be. They're the ones that have that hands-on contact with the people who are making the healthcare decisions out there. So we want to do all we can to make that a positive work environment, and Power2Transform has helped us achieve that goal.